Good morning, everybody. Thanks for inviting me today. I'm part of the NHS England and Improvement National Imaging team. So I've been working with RIS and PACS systems for quite a long time. I started my career as a radiographer, but I'm now working with the National Imaging team, looking at some of the IT aspects of forming up imaging networks. So that's what I'm going to look at today. So what is a network? Generally, it's defined by geography. So a group of trusts in a geographical area, in a region, get together to start to share services and potentially to share workforce, potentially to share governance and decision-making mechanisms. There are a number of dimensions to being a network, but they're defined very clearly by geography and patient flow. Some of them are quite small. So I think the smallest one we have has 2 trusts in it, and the largest one has 14. So there is a degree of variability in here, but the fundamental thing is geography. And why are we doing this? So the policy background to this, there has been a lot of talk in the last 15, 20 years about investments in diagnostics and problems with diagnostics. So we're aware that the system is absolutely under strain. So as part of that response, in both the NHS long-term plan, in the Transforming Imaging Services Target Operating Model, both from 2019, and then in the Richards Review of 2020, we started to see a focus, if you like, on imaging IT. So specific mentions in the NHS long-term plan about diagnostic imaging networks, and a lot of an increasing amount of attention to the absolute importance of IT in supporting those networks and supporting imaging services as we move forward. We'd like to see cross-organisational scheduling. Shared data and analytics is another massive opportunity that we can start to manage a network as a network if we can see what's going on all of the CT scanners all the way across the network. We have much better opportunities there for understanding capacity and demand, for understanding if we can start to potentially move workload about. We want to look at future-proofing. So we do understand that networks clearly serve a geography, but some people live near the edge of a geography and might want to cross the boundary. So coming to think about a future solution where images can move around inside the network, but also across those network boundaries a little bit more slickly than they do at the moment. We know that they can be moved at the moment, but the process is slightly clunky and a bit slow. So we need to try and improve that. Specifically in terms of what NHS England and Improvement are looking for, there's 2 very specific metrics on the bottom there. We're looking for networks to be able to do what we term a global patient search. You could also regard it as creating a single patient history, so that I can sit in my hospital in Bradford and know what other x-rays have been done in other hospitals in the network. And once I can see them, I can get them, okay? The other thing we're very interested in is shared reporting workflow. So the reporting staff, both radiologists and reporting radiographers, are under extreme pressure at the moment. We know that there is a massive demand for their services. What we'd like to look at is whether forming up into networks allows people to balance that workload a little bit better and provide a little more resilience to the system, as well as potentially opening up opportunities for specialist support. So if a trust in your network has a particular expertise in, I don't know, paediatric neuroradiology, for example, then it would be useful for the other trusts in the network to be able to access that. So those are the 2 on the bottom are the ones that we're most focused on, but that doesn't mean that the others aren't of interest. They absolutely are, and they are all things that modern IT can potentially do for your network. But there's also funding very specifically targeted towards IT. So IT and connectivity is seen as key to the next iteration of diagnostic services. So we're seeing investment in pathology IT infrastructure and systems, for example. We're also seeing the National Imaging Transformation Programme has now partnered with NHS Digital to form the Diagnostics Digital Capability Programme. And we will be looking very specifically at improvements in imaging and pathology, IT and informatics, looking to support the development of these networks and the maturing of these networks. So what does that mean in practice? So in 21-22, we will be allocating some funding around improving the sharing infrastructure. So this is about potentially an interoperability platform, a VNA, the elements we looked at a moment ago, which allow trusts to link up their RIS and PAC systems and share their information a little bit more rapidly and efficiently, and move towards this idea of a global patient search and a shared reporting workflow. We'd also like to see an increase in the use of home reporting. So home reporting for radiologists and reporting radiographers has been around for considerable time, but understandably received quite a shot in the arm during the pandemic. People became much more interested in allowing their staff to work at home, both to allow them to continue work when they're shielding, but potentially to allow them to keep themselves safe, to keep themselves isolated from potential infection risk. So very interested in moving that forward. We know that there are technical challenges and also implementation challenges with home reporting. So looking very closely at that.
It's always about having more information, and certainly the patient history is very key to a radiologist's interpretation of an imaging study, especially when you're only maybe given one prior, and that prior might not make reference to any previous history or surgical history that the patient's had. Useful information. I do find in some cases referrals are very, very sparse in the amount of information that's given, and that in itself can either lead to a follow-up, which, you know, if it had been reported potentially by a local person, might not be necessary. But if that information was made available, then the radiologist offsite could easily report it to the same level. If you have central reporting, you can leverage workflow tools for better use of available reporters. You can know when somebody's on annual leave, etc., and you can then hopefully, with intelligent workflow management, you can actually prioritize what studies need to be reported first. And that ultimately looks at improving patient care. As I said before, with integration with EPRs and the full availability of patient history, that would reduce and prevent unnecessary further examinations, and ultimately, with the intelligent workflow management, give you the right radiologist at the right time with the right examination.
Our mission. Things have been the same for many years in UK radiology, with a strong reliance on outsourcing, goodwill and locums to keep up with the increasing demand and pressure on NHS radiology departments. And our mission really is to disrupt this model and do things a little bit differently, with the ultimate goal of saving the NHS money, improving the life of NHS radiologists and delivering excellence in patient care. So to do this, we've partnered with best-in-class tech tools in the market with Mitis Health and Sectra to deliver this ambition and create a more seamless and pleasant place for radiologists to be working. Our VDI solution allows this to be done highly securely, very fast, so within a matter of seconds rather than minutes. There's no downloading of images to be done with this solution. And again, nothing ever leaves the HSCN network. It's streamed in much the same way how Netflix would be streamed to you at your home. Super fast, super secure, and it's one of the key differentiators in our solution here. Now, in comparison to some other remote solutions, which can take a number of minutes, in some cases a lot longer, this can be quite frustrating and obviously can actually impact the wellness and the balance of work for the radiologist and also for the patient impacted for urgent care and things like that. This is a super efficient workflow, and the reason that one of the big focuses we had when designing the workflow and partnering with Sectra and partnering with other people was to ensure that it was super efficient, super slick, and ideal for the radiologists in terms of their working. Secure VDI solution means rapid access, highly secure, and it maintains that speed regardless of the size of data set. So you could have 1,000 slice CT scan, it still will be downloading in a number of seconds.
The sector are independently recognised as the best-in-class PACS, and we have been for 8 consecutive years now. Very proud to hold that accolade. I think Axon needed a PACS provider that could handle the ups and downs of the live production clinical environment for streamlined reporting and a really high level of integration. So right from the very first meeting, it felt like there were a lot of synergies there, really. So if you could move to the next slide. Thanks, Paul. So just to start with here, Sectors PACS is a true multimedia platform, and that means that we're able to ingest, display, and even have specialist tools for multiple specialties involved in that diagnostic care pathway. So if we take, for example, the complex journey of a breast cancer patient, for example, from first diagnosis within the screening programme onto a symptomatic care pathway, with then further imaging, perhaps multiparametric MRI, histopathology imaging, medical photography, videos from surgery, for example. This means that orders are able to flow into the PACS. Reporting can then be performed within the PACS platform. And as Paul said, the results and reports are automatically orchestrated back into the source RIS, all without any manual administration whatsoever, thus improving quality and increasing efficiency.
Very important that we have valued, happy doctors. We know that our radiologists are our biggest asset, and that a happy radiologist feels valued, listened to, and looked after will produce a high quality report. We have employed a dedicated radiologist wellness manager to look after our team, address any concerns, and ensure that their voice is heard at senior management level. We believe that the more efficient our workflow is, the happier and less stressed the doctors working with us will be. So pricing, as I said at the start, one of the big aims was to save the NHS money. So we believe in pay fair, charge less. Axon Radiology invoices the hospitals at a substantial discount below market rate, encouraging insourcing and delivering significant cost-saving efficiencies. Supports you in the delivery of the NHS regional sharing strategy that Moira spoke about, as well as saving you money because you spend less on outsourcing. Because you're able to deliver a lot of the resource within your own consortium. And when you do need extra resource, it is at a discounted rate compared to market average. It provides a single hassle-free solution to manage reporting across hospitals. It empowers the NHS to deliver a sustainable and resilient diagnostic service without the increasing and unsustainable reliance on outsourcing or locums. It motivates your doctors to dedicate time to work for regional groups and not private healthcare or outsourced to teleradiology. It also maximises the efficiency and productivity of your doctors across multiple sites and increases the access to subspecialty expertise. Also, that obviously benefits patients in terms of the equality in regional access to subspecialty reporting. As I said earlier, tested at about up to 20% improved efficiency using our platform. And finally, and overall, importantly, it improves doctor wellness and supports sustainability for doctors to stay in the NHS happy for longer and enjoy their work.
I think we need to hold at the forefront the benefit to the end users, the patients from this. I think it will generally incentivize insourcing, minimize outsourcing, which means that monies can be released for reinvestment back into imaging services. What we would hope it would lead to is a community of practice within a region, which would, there's very much when you start talking about insourcing or outsourcing, you get that, well, it's not really my radiologist from clinicians, or I have a relationship with my radiologist and so down the road doesn't report quite the way I do. And I think if you can build that team within a network, you can break down that barrier, and therefore you can mean that you're not double reporting images and you've got confidence in what's coming out. And I also think it would allow for better understanding of the pressures in different parts of the system. So, for example, we constantly hear about, we want to follow the patient nearer home, but the large tertiary specialist centre want us to do this imaging test with 5 different sequences. Do they really need the 5 sequences? We don't really have the capacity in the local DGH, we can do them, but we don't have the capacity because that disadvantages other patients. So I think this is a good lever for harmonisation of protocols, for harmonisation of sequences, for all those things that often go into the too difficult pile. And these are the headlines. So we've got massive increase in outsourcing. The shortfall figures are based on demand, but if you talk about funded vacancies, we are 20% short of the workforce on absolutely funded vacancies right now. So again, this is not a small problem, and coupled with the demand, it's a real worry going forward.